employer. Now, all of this comes at a cost. And there have been a number of independent analyses of what impact this has on the bottom line. And I'm kind of picking on ABA, Applied Behavioral Analysis, because in many ways it is the big ticket item compared to other treatments that are covered by health plans. And a number of the states, as part of their research, as part of their committee hearings in considering mandates requiring coverage from health plans for services such as ABA, have published independent analyses, and the results are there on the screen. But they all seem to come to about a 1% or a 2% change in the bottom line to the cost of an insurance policy. And to me, the take-home message from this is the last bullet, that for every $25 increase in monthly premiums, and it is going to be passed on to the consumer, there's going to be a percentage of individuals who drop coverage. So while it is laudable for these states to have these mandates requiring coverage, there is also potentially an unintended consequence of costs rising too significantly. Now, federal parity is something that is due to be implemented in October. We haven't seen detailed regulations, but here again there may be some unintended consequences. What it requires is that if behavioral health coverage is offered in a plan, it needs to be on terms that are no more restrictive than the terms on the medical side. Now, it's up to the plan sponsor, the large corporation that buys health insurance for their employees and that pays the claims, to make a decision about whether autism is going to be on the list of conditions that they're going to cover. It's an option, it's not a mandate. The federal parity mandate says that if they choose to cover conditions on the autism spectrum, then they cannot do it on terms that are any more restrictive than the terms on the medical side, but they don't have to cover it. One of the concerns we have in the behavioral health area is that some of these corporate plan sponsors may elect not to cover conditions on the autism spectrum. We're recommending that they do, but one of the unintended consequences may be that they don't. Now, Aetna's perspective is kind of spelled out there, and it's at this stage it almost seems like we're waiting to see what exactly is going to happen. We're very concerned about the impact of mandates on the costs of health insurance, but basically we are in support of coverage for conditions on the autism spectrum. We are in support of evidence-based treatments. We would prefer that there be some limits on this so that costs can be managed, so that employers are willing to pay the premiums. And we're also concerned about having these mandates apply to all plans. You know, if it's a large employer, if it's a large population of individuals, the costs can be evened out. But when we're talking about individual plans or very small groups, one or two cases can really drive their costs into an unaffordable range. But I think the bottom line from the payer perspective, from Aetna's perspective, is we are part of the solution. We want to be part of the solution. We want to pay our share. We want to advise our customers, the large corporations that are buying health insurance for their employees and dependents, that conditions on the autism spectrum are health issues, should be covered, and let's figure out together how we can do that. Thank you.